According to media reports, Germany is in talks with the South African government to employ SA-trained nurses to fill vacancies in that country. Germany, which is Europe's largest economy, is reportedly seeking to recruit 500,000 nurses from Africa, including South Africa, to deal with the apparent shortages in its health system. Now, the news has brought attention to the country's own challenges, considering South Africa's own high number of vacancies in the country's hospitals. In 2022, it was reported that in Gauteng, for example, provincial hospitals should have 3,340 intensive care unit, that's ICU nurses, but only have 659 ICU nurses working, and no new ICU nurses have been trained since 2019. The Democratic Nursing Organization of South Africa, that's DENOSA spokesperson, Sibongiseni Delihlazo, joins us now to talk about this. It's good to have you. Thanks for joining us for a very, very important discussion here.
Good morning to you, Leanne. Thank you very much, and good morning to the viewers at home.
So, Sibongiseni, what is DENOSA's view on this particular matter? I mean, can the country afford to have such a high number of nurses migrate to Europe without creating a shortage crisis in the country, which, if I am not mistaken, we are in a shortage crisis already?
Well, indeed. Look, these places are in a very difficult position. Yes, as you have rightfully mentioned, we've got a serious shortage of nurses in South Africa, but the shortage of nurses really is a global challenge. It affects both the low-income, mid-income, as well as high-income countries. Now, how those countries respond to this shortage, of course, will always differ according to their economic muscle. Now, it's quite pleasing that Germany is really doing something about this. I wish I would say the same about South Africa, but unfortunately, we're not as fast in terms of responding to the current challenge of nursing shortage in South Africa. In fact, we even have nurses who are unemployed, which is a bit of a disjuncture, and it confuses the community out there. You are not having budgets in provinces increased according to the increase in the population figures and the burden of disease. And yet countries like Germany are doing honorable things by approaching countries like South Africa and say, let's talk about how we can address our issues in a way that will also address your issues. So we are quite pleased that Germany is talking to South Africa, but we are hoping, of course, that the talks will be of mutual benefits between the two countries. We will be saddened as DENOSA if South Africa would continue working on this current path whereby nurses are poached by the developed countries, and we're losing skilled nurses with good experience at a time that we don't have enough nurses in the country.
Help me understand, let's perhaps talk a few numbers. How many nurses do South Africa have at the moment that are working in the industry right now?
It's a very difficult question to answer, Leanne, because we don't have real specifics in terms of the numbers. What we have, and if you were to look at the South African Nursing Council, the number of nurses that we have in the country, those nurses who are able to work as nurses, is 208,000. But of course, those nurses work also in overseas, and it also includes nurses who are retired. And it also includes nurses who are in management positions, who are not working on the bedside, for instance. So it's a difficult question to answer, and we wish that the South African Nursing Council, which is the regulatory body for nursing in the country, would really try to specify the statistics so that everybody will be able to know how many nurses are working in our healthcare facilities. And also, we also wish that what you call nurse-to-patient ratios would be done by the South African Nursing Council. Fortunately, it has done the same on the teacher-to-nurse-student ratios recently. We're hoping that it does the same because countries like Germany have got all those statistics in place. That is why they feel pushed that they must address their current challenges.
Yeah, and that's a concern if we don't even have those numbers, because I was reading an article, it was published by Bloomberg, where they interviewed Richard Friedland. He, of course, is the CEO of Netcare, that's the private hospital group, saying that, according to their figures, that we are at least between 26,000 to 62,000 nurses short of where we should be. And that is a dramatic figure. I mean, we could say that we're in a critical condition and we desperately need to keep these nurses.
Well, I'm afraid that is the fact. And in fact, more crisis awaits us as a country. In the next 10 to 15 years, Leanne, half the population of our nursing in the country will be retiring in the next 10 to 15 years. And at the current moment, we're not increasing the numbers of nurses that we are teaching at our colleges and universities. Now, by the time we reach that in the next 10 to 15 years, and we will not have produced enough nurses for the country, we'll be reaching catastrophic levels of shortage. And we're also competing with developed countries who are poaching South African nursing, as I mentioned earlier. So it is quite a tight corner that South Africa is finding itself in. Unfortunately, we're not pleased with the commitment of our government in as far as addressing this issue. We are still having a bigger program like National Health Insurance. And of course, there were pilots that were done. And what was identified was a need to increase the staffing levels, the working conditions. These are push factors because nurses are yearning for their colleagues. They must be employed. They're also yearning for better working conditions. This is what makes many nurses to pack their bags. And many nurses have got their bags packed and are ready to leave this country. And we're not going to get those nurses back once they leave this country. There's nothing that will keep these nurses into South Africa for as long as these conditions are not improved.
And this is the reality, because at the end of the day, you know, one would obviously have to understand the different packages that they will receive, and you know, and I suppose money talks as well. The reality is that if they are moving and they are getting better packages and better circumstances if they do move over to Germany, as we've been hearing, I think nurses would take that, because there has been many calls from unions such as yourselves for the treatment of medical professionals, and in particular nurses, who firstly are very much so underpaid, overworked, and the health department are just not coming to the table to try and resolve this situation. So, I mean, in your opinion, I imagine this is a great opportunity for nurses that cannot find employment here.
Well, it is, to be honest. This is where I mentioned that you are found in a very tight corner as DENOSA. We know that the nurses that we produce in South Africa are to serve the South African population, and we don't have enough nurses, as I mentioned, and yet you have nurses who are unemployed, and yet there are vacancies in the government healthcare facilities. I mean, how do you answer to the nurses who are not employed and say, please be loyal to your country? You know, how do you convince that nurse to remain in the country when they are not working? And yet the long queues in healthcare facilities are such that the nurses who are in those facilities have lost the passion for nursing, and they have the conditions have just demoralized them. And unfortunately, this is why I mentioned that we're in a tight position. Of course, it occurs well that nurses must look for better opportunities elsewhere. If government is not paying nurses, and payment and better conditions are at the top of what push nurses out of the country and from their countries to developed countries where conditions are much better, for instance.
Unions have been asking the government to employ nurses in South Africa's health institutions. I mean, we've done these interviews over and over again. And I mean, I even remember doing these in COVID at a very desperate time. Last year, Baragwanath's crisis was being a case in point, where unions were asking the government to permanently employ the nurses who were employed on a temporary basis. But the understanding is that the South African health system has its own shortages and is in a crisis as well. What do you believe is the reason behind the shortages within our healthcare system? Is it because there's a shortage of trained nurses, or there's just not enough money to pay at the moment?
It's really a combination of those, Leanne. But of course, the issue of shortage is a serious one. But what we are finding disturbing as DENOSA is that each and every year, instead of increasing the budget for healthcare services in the country, the budget is decreased, whereas the numbers of populations are increasing, and as I mentioned earlier, the burden of disease. But in spite of that, even the fewer nurses that we are still able to produce, we're not able to absorb them due to budget constraints. Now, it confuses us, and it still leaves us a bit, gobsmacked as DENOSA as to why the government still treats healthcare services like any other services. Healthcare service is an essential service. People do not choose to be sick, and yet you still find that the government is not committed to increasing the budgets to ensure that this essential service is taken care of. I'll just give you an example. Germany has got 84 million population, and South Africa has got about 60 million population, if you obviously do not include the foreign nationals who obviously need to be cared for here when they're in South Africa. And in Germany, for every 59 people in that country, there is an allocation of a nurse. In South Africa, an allocation of a nurse looks after 213 people. You can just imagine, and yet Germany is compelled to take these drastic steps, whereby it has to talk to nations like South Africa, and yet we're doing very little in our case to at least keep on to the very few nurses that we have. The issue of COVID you mentioned, it tested our resilience. It tested our country's resilience in terms of healthcare services. I mean, we talk of ICU. We didn't have enough nurses in ICU, and many patients needed to be cared for in ICU. And because we don't have enough nurses who are trained on ICU specialization, and those nurses are taken by these countries like Germany, UK, and the likes, and we're doing nothing to increase. We had public nursing colleges that were closed before democracy in this country. There was a commitment and upon identification that their reopening is necessary. And yet, even now, they have not been reopened. And you are talking of national health insurance. At the time, we don't have a shortage of nurses as we speak.
Yeah, all right. Just as I wrap, and please, very quickly, just clarity. The National Department of Health said it distances itself from this Business Day report, and it was wherein DENOSA Deputy Secretary General Kaya Sidori was quoted as having confirmed that Germany wants South Africa to train the nurses from them, mainly the unemployed youth, with a shortage of about 500,000 nurses. Now, while South Africa has about 20,000 unemployed nurses, also confirming that there are continuous engagements about nurses between Germany and SA, but nothing has been finalized yet. Do you know the source of where this information is actually coming from?
Well, as far as we're concerned, we were approached by the publication because there was a career expo in Johannesburg last week, where apparently the Minister of Employment and Labour did mention this area, and unfortunately he mentioned it as a done deal, that South Africa and Germany have concluded a deal whereby there will be this program exchange. Unfortunately, from our case, we cannot confirm that, and we're a bit unhappy with how Business Day had positioned us as if we're the primary source of that information. But we are a nursing association in this country. We are still pleased that our government will always, from time to time, talk to us about talks that it has with other countries, especially on matters that relate to nursing. All right. We are aware of such talks, and there's nothing to be secretive about that.
Okay, let's leave it there. Thank you for confirming that for us. Sibongiseni Delihlazo from DENOSA talking to us about this whole issue with regard to unverified news regarding Germany's apparent intention to recruit about 500,000 nurses from Africa, including South Africa, to fill vacancies in its country's health system.